name is Olle Ljungqvist. I'm a surgeon from Sweden, and I'm also a co-chair of the European Nutrition for Health Alliance. And I co-chair this organization with my good friend Regina Rolle-Winsberger from Austria, who you will meet very shortly. I will be back in just a moment, but I'd like to hand over to Regina to give a welcome word.
Thank you, Olle, for handing over. A very warm welcome also from my side to all participants and guests. As you know, food and nutrition is very high on the agenda of the European Commission to ensure health-related quality of life and well-being of European citizens. However, the concept of integrated nutritional care in healthcare systems is not yet well established in all European countries. It's therefore the aim of today's meeting to build capacities across the Union and to include everybody interested in the topic. And I wish you a very pleasant meeting, and I would like to hand back to Professor Ljungqvist, who will give you an overview on what will be going on today.
I'd just like to start off by setting the scene to inform you a little bit about our organization, our charity, by starting off by telling you that if we are truly serious about health and healthcare, we need to take nutrition very seriously. We are running a program across Europe called Optimal Nutritional Care for All. And our aims are to make sure that every European citizen who is malnourished, who is at risk of malnutrition, or have a chronic or acute severe disease, will be screened for nutritional issues, for malnutrition, to secure that they get high-quality nutritional care. Our organization is based on a multi-stakeholder European collaboration. We have gathered everyone that we could possibly think of that has a stake in healthcare and nutrition. So we're talking anything from any group from the patients, obviously, but also from different professions, doctors, dietitians, students, but also payers and other organizations such as the industry, and also we have, of course, the insurers, etc. The objectives that we have with the EU for Nutrition is to secure that optimal nutrition and nutritional care is there for all EU health policies, and that we have adequate information to support citizens and patients out there. We want to make sure that we have shared decision-making between patients and professionals. And we believe very strongly in this multi-stakeholder collaboration. And the way that we do this is by sharing good practices between professionals, students, but everybody involved, actually. We see that we have a lot of very important EU health initiatives, but they need to move to the local place where actually care takes place on a daily basis. So today we have the EU for Health initiative, which is focusing on cancer. And we feel that EU for Nutrition has to play a very important and central part in this. The EU is working with national healthcare, and at the national level, we need to do implementation in order to get that local impact. Because remember, healthcare happens on the floor. So how do we do this? Well, we run EU health initiatives and implement them locally. And this is just one of our website pages showing what's happening in Denmark. And if we move to the next slide, I'd be happy to tell you that we're doing this multi-collaborative effort by sharing good practices. When somebody is finding something is working in one country for a specific cause, we share that with everybody else, and we bring it across Europe. So let me give you an example. For instance, if we find that we can educate patients on nutrition in a very effective way, as they did in one country, they start to share that with everybody else so that we can make use of all the good practices that we have in Europe. With that, I'd like to move over to kick off and introduce the program of today. So to my right, I have Laurence Doughan. She's representing the Belgian. the Belgian government. And she has a very important job because she's a coordinator of the National Food and Health Plan. And further to my right, we have Marc Tarabella. He's an MEP for Belgium, so he's European Parliament. He has worked with sustainability in different forms for agriculture to make sure that the food that we have and the future of food production is functional, but also in the future for our kids by working with food in schools. And I'd like now to move to Madrid, to our studio over there, where we have some experts in COVID-19. So I'd like to address Cristina Cuerda, who is leading the group in the center here. She is the General Secretary of ESPEN. I would say that that's Europe's most important multi-professional clinical nutrition organization, and she's a specialist in nutrition. She has two colleagues with her, Santiago Moreno, who is an infectious disease specialist, and Leocadio Rodriguez Mañas, who is running a big department for geriatric care. So they will be focusing on COVID-19. We then move to Amsterdam, where we have oncology as the topic. Bert van Eyck, he's the medical director of oncology for Nutricia, so representing industry, another stakeholder. We have Rana Orhan, representing the students, the European Medical Students Association. And finally, but not least, Robert Green, who is a board member of the European Cancer Patient Coalition. So you can see we have a broad group of people representing all the different stakeholders all the way through with us today. Now, I'd like to start this session, this plenary session, by introducing Aldo Patriciello, who is another MEP from Italy, and he is the Vice President of the Challenge Cancer Intergroup. And I'm very happy to have him just give us a message about the importance of nutrition in cancer care.
Ringrazio gli organizzatori per aver inteso promuovere un momento di confronto e di dibattito su un tema di estrema attualità come quello odierno, approfondendo in particolare il nesso esistente tra alimentazione e malattie oncologiche. La malnutrizione e la denutrizione colpiscono 33 milioni di cittadini europei, rappresentando un onere inaccettabile per i bilanci sanitari, oltre che un ostacolo alla prevenzione e alla buona cura delle malattie oncologiche. La malnutrizione è infatti una condizione di indebolimento delle riserve energetiche, proteiche e delle nutrienti dell'organismo tale da aggravare lo stato di salute dei pazienti. Nei malati oncologici la denutrizione, che viene non a caso definita come la malattia nella malattia, può seriamente compromettere il buon esito e il proseguimento delle terapie antitumorali, chirurgia, radioterapia e chemioterapia, come anche la vita degli stessi pazienti. È ormai scientificamente dimostrato che la malnutrizione non è conseguenza della malattia, né un effetto collaterale delle terapie antitumorali, ma è, almeno in parte, prevedibile attraverso un adeguato supporto nutrizionale che deve essere preso come parte integrante del percorso terapeutico del malato. L'Unione Europea sta lavorando attivamente alla nuova strategia sanitaria per la lotta contro il cancro e in tale ottica ritengo che questo evento possa dare un importante contributo a tutto il sistema. L'auspicio è di gettare una pietra nello stagno per rafforzare l'impegno delle istituzioni europee al fine di favorire lo screening nutrizionale per le persone a rischio e per i pazienti, garantire la parità di accesso dei pazienti alle cure nutrizionali, sostenere i programmi di studio e i programmi educativi in materia di prevenzione. Questi elementi rappresentano una imprescindibile base di partenza per dare finalmente all'assistenza nutrizionale l'importante ruolo che merita e integrare un'alimentazione ottimale nella cura dei pazienti europei.
So I'd like to thank our colleague from Italy, Aldo Patriciello, for these words. I think they really set the scene. So I'd like to start off by asking you, Marc, how can you and your colleagues in the European Parliament help introduce nutrition and nutrition care in basically all the different EU health programs that you're proposing?
Thank you, Olle. And to answer your question, I think that at the European level, we have first of all to encourage some event like this and to inform all colleagues, because as a member of the European Parliament, we have the co-decision on many matters, as now agriculture. I speak about agriculture because I'm involved in the Committee on Agriculture for 15 years, but now we have the co-decision with the Council, with the whole government, and it's possible to push. We are at the key moment for the Farm to Fork strategy that Mrs. von der Leyen announced, but we have to work on that and probably to promote another kind of agriculture, more respectful of environment, on a good, and nutrition is linked to that. I'm also involved in the development committee, also food and good food, also in Europe, but also outside of Europe. And I think that we can push not only with some resolution, but also on legislative proposal. And unfortunately, maybe I work, for example, you spoke about the nutrition in school, because I worked on this fruit, vegetable and milk schemes at schools a couple of years ago, and we were very pushed to promote fresh vegetable and fruit at school, less processed food, and I think that it was useful. But unfortunately, some member states has a strategy, and sometimes the key message given to the European level is well applied in some countries and less in other countries. Example UK, but they are away now. Okay, but they refuse this program, but it's not. Yeah. It was not a surprise. But we have to push and to continue, because I'm convinced that nutrition is a key for better health care in the future. Because nutrition, in French we said nutrition rime. It's the same sound as prevention. Mm-hmm.
Mm-hmm. How would you look at what we're coming from with the multi-stakeholder organization? How can we interact with you, do you think?
Unfortunately, with the COVID period, organizing this event is very important. Mm. Of course, it's more useful when you organize inside of the Parliament, inviting other colleagues to convince them from several committees. First step is this one. Maybe also to organize those kind of events, but also to be more coherent. It's our problem in the European institutions. I think that we have to be more coherent between all policies. If we speak about agriculture, but it's linked also other policy, with trade, with environment, in maybe with development, and it's too long to explain one mechanism, but to be more coherent in the same way for a strategy on the long term.
Okay. Very interesting. Thank you. Well, let me ask you, Laurence, because the Belgian Ministry of Health some time ago actually joined our program, the Optimal Nutritional Care for All program, and I would be interested to hear your experiences. Why did you get on board to begin with?
In fact, Belgium was involved in the very beginning to implement undernutrition issue as a priority in Europe. So, of course, it was a normal, logical continuity to jump into your initiative, since we have a long history in that field. We began our work in 2006 with our nutrition and health plan strategy. And first of all, we have tried to emphasize the awareness of the civil society on that topic, because as you may know, undernutrition is not enough welcomed by the media, by the physician too, by the nurse. It's difficult management and first we have to think about the awareness of the civil society. as a whole. So your strategy is very keen to emphasize such awareness. So we have jumped into your European initiative, but we have also at a local level implemented a platform with all our stakeholders involved in undernutrition since 4 years, and we have set different expert group on different topics within the matter of undernutrition, such as the quality of food for the patients, or education, what is the background needed for physician, nurse, all professional, healthcare professional involved in that problematic. So
yeah, no, I just wanted to ask you, because it's unique to have such a good program running in a country and with the government so closely involved. What role are you taking on from the government point of view in all of this?
We are facilitating all this process, inviting all these stakeholders, but since 2007 we have already initiated a platform in 2007 with organizing a congress on home care and care homes at international level. So we were very, very we took the importance of that topic in the very beginning, and several countries, as France, has also jumped into this problematic. But it's not easy also to convince at EU level because nutrition is more, and maybe this is why you are speaking about nutritional care instead of undernutrition or malnutrition, because the perception is much better to speak about nutrition instead of undernutrition. Also at EU level, we had to convince European Commission about the right, the place of undernutrition in the debate. It was really a difficult challenge.
Yeah, that's actually how we started to be able to get some traction inside the EU. We were managed many years ago to get undernutrition as part of the EU policy, not only obesity, which was on the agenda back then.
Yes. And you speak about obesity, but what I think is important in your organization, that you are globalized in 19 countries, I think is very important.
Yeah.
When I saw the map from the northern to Sweden, from the south to the south of Greece, we have the same problem. Also in the Mediterranean country, they suffer also, young people suffer more of obesity. But obesity on children is a bomb for the future, for healthcare. And I think that nutrition, I speak always about nutrition. Hydration is also important.
Yes.
And physical activities, sport at school, develop sport. Some countries they are efficient, the other not. And of course, it's very useful that you are working at the European level, because we have all countries the same problem.
Yeah. Well, actually, we have a third member of this panel that I'd like to introduce, Matthias Schuppe. He is in Luxembourg, and he's the team leader of the cancer plan for DG Santé, so he represents the Commission. And I'd like to ask Matthias to join us, and if I could place a question to you. Now, the Commission actually favors a holistic approach for the Beating Cancer Plan, which is another important plan for the EU. Now, would you agree that nutrition and nutritional care are important components of such an approach?
Well, that's for sure. As you already mentioned, we try to address cancer holistically, which means starting from prevention through early diagnosis, treatment, and then follow-up care to survivors. And indeed, nutrition plays an important role here. The first element, which has already been mentioned, is in the prevention part. That healthy diets, avoiding obesity, and then also physical activity is a factor in reducing cancer risk. So we have here a very important element in the prevention part, but also, as mentioned already, in the area of medical nutrition. So for patients to have better outcome, nutrition is also quite important. And in that sense, the plan will not focus only holistically in covering the entire disease pathway, but also take a citizen and patient-centered approach across these different domains, which also means that we are focusing on an integrated approach and a team approach when it comes also to the health system and healthcare, which means that all health professionals and allied professionals need to work together as a team to provide optimal care to patients.
I couldn't have said it better myself, actually. I think that's right on the spot, and I'm delighted to hear that we have a lot of same views towards where we're heading. Now, I'd like to place a couple of quick questions also to our other teams around that we have. So I'll start with Amsterdam and ask Erik van Eyck. Could you, in a few words or in a couple of minutes, explain to the audience and all of us why we involve cancer in this EU4Nutrition program that we're running? Why is cancer such a big thing?
A lot of people die, of course, from cancer. It's an open door, I know. But if we also see that nutrition and nutritional status screening is, and it's often also underdiagnosed, therefore it is and also becomes more and more important. Therefore, if I go back to my students' time, I would say there was not such a thing like education on nutritional status, on screening cancer patients, basically. And I think with the EU Beating Cancer Plan and all the initiatives that's going on, that it's getting more important, that it gets the focus that it deserves for saving lives of patients. Also, let's not forget, a better nutritional status means for these patients, their chemotherapy regimens basically will give them a better quality of life, longer survival benefit. So there are a couple of parameters basically that we should really focus on the nutritional status, on the screening, but like you said, Olle, and like Matthias is also saying, on the, let's say, to be on the spot. I also like to pose this question, by the way, to Rana. She's at the basis, if I may call it, the students, the medical students. What role education, nutritional status means for students in the curriculum? Because in my previous experience, there was not such a thing like nutrition. What do you think?
Well, how long ago is that?
Long time ago, so 25 years.
Well, let's say for me it's been a couple of years as well, and let's say nothing has changed. Still in Europe, it's at the discretion of a medical school or maybe the government. I hear a very good example in Belgium about including stakeholders, I assume students as well. But it's still lacking in education. And there are a lot of initiatives, as you said, the EU Beating Cancer Plan, the Farm to Fork strategy, the Green Deal even talks about the European competency framework. But I don't see the education of medical students or other healthcare students in there. Well, at least for me, it's not emphasized enough. What I would say is if you have expectations from healthcare professionals, then let's start early in education and make sure that we as future healthcare professionals know which responsibilities we're going to face in the future.
Yeah. Anything to add, Robert, on behalf of the European Cancer Patient Coalition?
Well, she said it all. And it is just important. It's not an issue anymore of just talking about it. It's an issue of really implementing it as well.
Yeah. Later on, we come back to the survey ECPC did. What one of the 3 patients is malnourished, basically. But before we tackle this topic, I would like to hand over to Olle.
Thank you. We have also a team over in Madrid. So I'd like to ask Christina, of course, we've all seen how hard Spain, and in particular perhaps Madrid, has been hit by COVID-19. And it would be very interesting in these times to have you just briefly tell us about what the impact has been of nutrition in helping these people actually surviving COVID-19.
Okay, thank you, Olle, for this relevant question. I think it is very well recognized that COVID disease is more severe and causes more mortality in patients that are malnourished. On both sides, on both extremes. On one side, patients with undernutrition, many of them with suffering chronic diseases, elderly patients, patients with polymorbidity. And on the other hand, patients with obesity and overweight that present a greater inflammatory response to this virus. So I think in this situation, we can say that nutrition is even more important than ever. So we should implement prevention, diagnosis and treatment of malnutrition routinely present in the management of patients with COVID disease.
Well, thank you very much, Christina. I'd just like to let everybody know that we are going to have breakout sessions, and you will hear much more from these experts in just a moment. But for now, I'd like to introduce another speaker, Sara Cerdas from Portugal. She's an MEP. She has been working a lot about preventive measures using nutrition. She's the co-chairman of the Working Group of Health in the Parliament and vice chair of the Special Committee for Beating Cancer.
Hello everyone, I would like to thank for this invitation to speak to you about an important topic, about nutrition. Nutrition is one of the key pillars for healthy lifestyles, but we have that in the European Union we have that 33 million of people are suffering from malnutrition. We have the double burden of nutrition, we have the underweight and the overweight, but the EU has an important stance on food safety. We should work for greater food safety, and for that we need to talk a bit about the farm to fork strategy, which we will allow for people to have healthy options at their table from the whole process of production. We also need to speak and address about the biodiversity strategy. We have the EU for Health program, which in regards to nutrition aims to tackle the risk factors for many of the diseases that are burdening EU citizens at the moment, and with this we aim to increase health promotion and health prevention. Why this? We want to capacitate citizens to make healthier and active choices in their diets, for their nutrition, to live a healthier lifestyle across the EU, and to reduce the burden of disease that comes from malnutrition. Thank you.
Well, with that word from our MEP in Portugal, Marc, how from a preventive viewpoint would you see that we could all work together, EU and all of us here, national governments, etc.?
To be efficient, I think that we have to work together, of course, and maybe to see the fact at the European level, to take measures by directive or rule, but the rule is difficult because we have to implement in several states and we have to respect national authorities, national body. They are working hard on that. Probably, but you know, sometimes I regret that we decide some rules at the European level and they are diluted in each country. And probably we have a monitoring with the country, close to them, the authorities, and probably, and they do that, the exchange of practice, of good practice, are useful. And maybe to monitor by the Commission, the European Commission, to monitor and to check in which country we make progress, in other not, and probably to have a system to compare our results and to progress together on the same way.
Could you envision that, for instance, we have in your own country, we have a government that has really embraced this way of working and done it very, very successfully? Be interesting to hear Laurence and your views to her comments about how we can form let's say, get a meeting place, because I think a lot of times it's about meeting people. It's about sitting down and talking to each other and actually looking at the problems together and learning from each other. How do we create that in an environment of EU politics and national politics and all the stakeholders? I mean, that's the challenge, isn't it? Laurence, any views? It's a tough one.
No, it's not tough, because we have already done the job. I mean, it's a question about listing the partners, I think, and address the good one, because since we reach one of them, we need to address another one, because you see that's a very complicated puzzle, in fact. And It works, in fact, because it's a good way to forward. WHO encourage a lot the multi-stakeholder approach in several thematics, and it works also for this one. But of course, we are limiting sometimes about some set of recommendation is good, but probably sometimes we need more regulation. It's always the limit of a multi-stakeholder approach, since you have different interests and sometimes you have conflict of interest or different ideas or views. We need definitely to have a multi-stakeholder approach, meet, if we can meet. It's not easy.
Right now it's
in 2 weeks we will meet our ONCA, Optimal Nutrition Care for All national meeting. We will have this meeting in 2 weeks, so it can be, but it is quite complicated now. And of course, it must be joined to another effort in a structural manner. I mean, within the authority, set of recommendation is good, but regulation is also very important. But as you have said, Marc, sometimes it's difficulty between EU decision translated into national and also opposite. I mean,
exactly.
What do you feel?
I think that in Europe, perfect Europe, probably the decision could, with consultation of stakeholders, and then take decision and apply everywhere in the country, as the roaming, the telephonic tariff of the roaming disappeared because we decided at the European level, but with a delay, first decreasing and after abandoned. But it's not the case for the situation. I think that it's a job for everyone. Of course, at school, of course, but we have to teach children, but not only children, also their parents first. I know that in my country, the mutuality of healthcare, Solidaris, they organize some informations to eat more balanced diet meal, and I think it's a duty for all stakeholders. Also on the field, the grassroots sector, in every sector. The canteen on the hospital, very important. In Liège, in Sara, in my city, very good example of collectivity cooking. The Clinique du Bois de l'Abbaye in Sara, Mr. Gerard Philo, it's a pioneer on that.
Exactly.
And I think that we have to teach and to exchange our best practices. I believe more in that.
Where can we create the arena for people to meet? I mean, if you have specific and good experiences of doing this from a government, and you're providing, the arena and the meeting point, and you're supporting all the stakeholders in your country, how would you like to spread that word to my country or to other countries? Where should we meet and how should we arrange that?
Probably at EC level, I mean.
Yeah,
when we meet on specific topic. But first of all, EC should implement a real strategy on undernutrition or on this specific topic. Like this, I can share my views with other member states. I mean, this is the way to forward. I think we have to optimize your optimal nutrition care for all. With a real status within the EC. I mean,
well, you're bringing up something which is, I think, a crucial issue, is that we don't have a lot of data. Actually, also, we don't have. We may have data on outcomes, diagnosis, and things like this, but on process, we miss data a lot of times. And I think that's something that we can talk about maybe at another time. But I'd like to bring in also Matthias. From the Commission and get your views on if there's a way from the top to actually create that meeting point where all of us who would be stakeholders could work together, meet.
Well, actually, I think this meeting point already exists. It's the Commission's health policy platform, which is open to all stakeholders. Unfortunately, I have to say that the cancer community is a bit underrepresented at the moment. But it would also be a platform for us to engage with stakeholders, not only now during the development of the cancer plan, but also for the implementation phase. We already have a network, a thematic network on colorectal cancer screening, for instance, and the platform would be open to all stakeholders and interested parties to create new platforms, new thematic networks to exchange ideas and views. So I would perhaps invite also your collaboration and platform to consider coming on joining the health policy platform, perhaps to broaden also the scope of the collaboration with other stakeholders, because as we heard, it's important that we work cross-sectorally, that we work also with the agricultural industry, that we work with the food industry, and perhaps also when it comes to implementing or changing perhaps the training schedules of health professionals or treatment or screening guidelines, that the nutritional aspect is also included here. So I think this collaboration needs to be very cross-sectoral and across different specialities.
Thank you very much. What I would like to do now is to just go back to our friends in Madrid and ask them with regard to the COVID-19, because that's been a huge issue for all of us in healthcare. And of course, you've been right at the center of the storm. I would be very keen to have you discuss a little bit on how you actually managed to make very drastic changes in everyday care and reorganize your hospitals to manage the storm of patients that were coming for treatment for COVID-19.
Thanks for your question. It was, from a professional point of view, it was a true challenge. For instance, my hospital is a hospital with 600 beds, and at the end of March, it was fully dedicated to COVID patients. This means some things. This means that all the professionals were dedicated to care for these patients, including surgeons, including people and dedicated to other services that are not used to treat medical patients. And indeed, many of the regular tasks, outpatient's office or rehabilitation or the hospitals were closed. And these facts, these challenges were really, really hard to overcome. But I think that we were very successful in managing the issue. We have also learned some lessons that now in this second wave we are unfortunately living are of some help for facing this second challenge. So I think that in March, April, and perhaps until mid-May, we changed. We made substantial changes in the organization of our health service, but I do feel that we were successful.
Okay, thank you. Thank you very much. I think the crucial issue for healthcare is many times actually being able to make changes. And I think that and you gave us a very good example of that, we were able to make tremendous changes in the way that we work when we were under pressure. And if we want to move with better nutritional care, we have to change the way we practice and make something very basic part of our daily routines. We have to look at nutritional issues when we see every patient and look at, is this patient at risk of malnutrition? Does this patient have a chronic disease? We should have nutrition with us all the time and be ready to do that screening. Now, given your experiences, and I know that this is a very different situation, but could you give us some ideas of your thoughts around how we actually help ourselves and all of our colleagues to actually think in a new way, to work in a slightly different way?
I have told you in my first answer to your first question that we were very succeeded in changing how the healthcare was provided. But I must add that we were very successful to provide care for acute care patients. The issue is that for chronic patients, the success was not so high. For providing care for people at the hospital, we, for instance, close outpatient offices, and this means that many of these patients were not properly attended. And this is chronic patients usually, and among them, probably the biggest part were old people needing many healthcare attentions that were not provided properly. And one of the issues that indeed in those who were admitted at hospitals that were not properly covered is, one of them is probably nutrition, and the other one is physical exercise. And this is very important when you are going to attend patients with COVID, because one of the consequences of COVID is a consumption, for instance, of your muscle. Many patients were alive at the end of the episode, but were really functionally impaired. And this is very, very true when you are caring for older people. This was true, of course, in the hospitals, but also in another setting of care where people is usually malnourished, as in nursing homes. In many nursing homes where the patients were put in locked down in some way in their own rooms, when they have to walk again, it was quite clear that they had lost a big part of their function during the days of isolation, of locking down. So we must be very careful in the way of we are providing care for these patients. Of course, it's very important to avoid deaths, but when you are approaching chronic patients, and mainly older people, one of your main aims should be to care for their functioning along the time. And for doing this is very important care for nutrition and for physical exercise. And I think that for this aim, our system was not so successful.
Thank you very much. And I think that really represents the challenge. Well, I'd like to just give my guests here in the studio one last chance to say any final comments, anything that we forgot to talk about with regard to your different roles here and what we can do together. Marc?
I think that we have to face all the same issues. As a Social Democrat member of the European Parliament, I appreciate a well-being for all citizens. And I think it's a global fight, and I think it's an alliance, a clear alliance, and multi-political group, multi-country. We have to face the same issue. And I think it's a global alliance between nutrition, better nutrition, hydration, and physical activities for all people, young people, but also older people. And I think that this would create a society with more equality between citizens and less cost for the social health care and a better living. Because in French we said, ça ne sert à rien d'ajouter des années à la vie, il faut ajouter de la vie aux années. It's not useful to have a longer life. It's for spend 40 years in a bed, and I think to feel better. It is a key issue that we have to face all together. And thank you for your involvement.
Thank you, Laurence.
I think most of the things are already told, but maybe I can just add that nutrition should be considered as a part of the treatment, especially with all this event that we are living now in this pandemic context. We see that we didn't give enough importance to the link between nutrition and health, and we should exacerbate nutrition in university. I mean, the physician should be better educated. And a pediatrician, all the healthcare professionals should consider nutrition as a key element in the treatment and in the prevention, of course, because we don't want that people are patients. We want them in good health and in a good status. I totally agree what you have said, Marc, of course. Thank you.
Thank you. Well, we heard that we have a lot to do from our representative from the medical students. Well, also, Matthias, I'd like to give you a chance for some final words around this topic today.
Well, thank you. First, let me thank all the organizations involved, also to their contributions to the consultation on the Europe's Beating Cancer Plan. Which will help us to develop a very holistic and inclusive approach to address cancer. Secondly, I would like to call on you to stay engaged beyond the development and the adoption of the plan, because then we have to move into the implementation phase. And there, the feedback and input and collaboration of all the stakeholders will be just as important as it is for the development of the plan. And in the different areas, I would like to highlight that, as I mentioned, we already have a stakeholder platform where we can facilitate collaboration amongst very many different groups. I would also encourage the sharing of best practices, as has been mentioned already. And for that, we also have a platform. So perhaps in the future, we can stay also engaged and discuss also with your colleagues here how best to feed into these existing processes at the EU level, so that we can actually share most efficiently and effectively also the best practices and good knowledge that has been accrued over the years and can then be taken forward at member state level and implemented. Thank you.
Well, thank you very much. I'd like to, before we close, I'd like to also go one more round over to Amsterdam and ask Robert, you've listened now to all the different speakers and stakeholders here today. I'd like to hear your final words on what you're hearing and how you look at that, because after all, we're doing all of this for patients.
Nutrition and malnutrition is not only a patient issue, it is indeed a citizen issue. So I would hope indeed that all the stakeholders, multi-stakeholders get together, we learn from each other, and in the end, it would save us a lot of money is important, but also looking at quality of life. It will improve our quality of life. And I'm not saying this just from a perspective of a membership at ECPC or Hunger and Thirst, but as a former patient as well. It is important. It is very important. So we need to take action now.
With that, I think we've heard very clear statements from everybody involved. We all like to work together. We all have the same direction where we want to go. So I think the future looks bright, actually. We just need to pinpoint a few issues, but I think Matthias mentioned that there's already a platform, a meeting point, so let's explore that further. And for sure, we will be engaged and be available to take this further as best as we can. But so let me wrap up this first session by thanking everybody for their contributions. And I'd like now to hand over to Regina to present the breakouts. So over to Austria.
Thank you, Olle, for handing over. Thanks to all participants for giving this nice overview on all the challenges we are facing and all the opportunities we have in our hands. We go into more detail now into the next 3 workshops. One on EU health policies. We have a workshop on COVID and nutrition coming from our Madrid studio. And we have some insights into the beating cancer and how to implement nutrition from our studio in Amsterdam. Have your short break, relax, have a cup of coffee, and see you soon. Thank you.